don't know who needs to hear this, but don't let your boyfriend stop you from meeting your husband. Okay, that's another story for another day. But today we're talking about nursing. So don't let your job stop you from protecting your license. Don't let your job let you lose your license. In today's day and age, there's so many things that new to practice nurses aren't aware of. And I think it comes with a lack of knowledge about the industry and healthcare, but also a lack of mentorship. So if this is your first time meeting me, I'm Tanya, I'm your favorite new nurse coach. I've been a nurse for 18 years, a nurse practitioner for 12, and I have mentored new to practice nurses since 2020. Today, we're talking about how your nursing license can be compromised just by simply choosing the job that you start to work at as a new to practice nurse. So, I'm working with a client right now, and she is a med surge nurse. She is BSM prepared, and she got her job less than 6 months ago. But what she's noticing over that time, since her orientation and starting her new role, it has drastically changed in the requirements for what is within the scope of practice for her. And I'm really careful how I'm saying this because I want to um, accurately describe what's happening with her. And I think this may be applicable to a lot of new nurses. So she first started out on a med surge floor, right, working night shift. She had about 6 patients, and it was primarily a respiratory floor. Now, since she's gotten off orientation and been off orientation for a couple of months, the floor has now transitioned to what I consider to be a step down unit, but still is being described by her managers as med surge. Here's the gist, guys. Now she's responsible for trach and vented patients, and her managers and bosses are saying that these patients are stable trach and vented patients. When we last had our one on one meeting, she told me her previous shift, she had 3 vented patients. Now, I've worked as a nurse for a very long time. And as I said, I worked on a step down ICU, so I understand what it means to take care of patients who are trached and vented. I've never taken care of 3 trach and vented patients in one assignment in my whole career as a nurse. And I worked on what was classified an intermediate care unit. She is still working on what's considered a med surg unit. Now, you tell me, how is it that a med surg unit is taking patients who are trached and vented? Okay, it's a specialized area. I think she says it's about 10 beds. And guess the ratio for nurses. On that side, there's only 3 RNs. So you mean to tell me for 10 vented patients, one nurse is going to be getting 4? Make that make sense, people. Okay? Make that make sense. Make that make safety for the patient. That is the priority. And so I implore her to talk to her managers because she needs to know the policy. And guess how much time she had for orientation? One shift. One shift. Okay? You know what? That is not even 1 hour. I apologize. 1 hour she had of training for trach invented patients. 1 hour. She's my mentee. So she has access to my knowledge. She has access to my experience to know that is not normal, that it is not okay, and that is definitely not a med surg floor. So, guys, when we tell you, find someone on the floor that you know and trust, when we tell you to document appropriately, because these institutions will test the scope of your practice. And if you do not know to what level you can and cannot accept an assignment, you will be taken advantage of. You will be taken advantage of. So do not let your job let you lose your license. If you want more information like this, go ahead and check my link below. You can book a one on one consultation. And I really hope that she's just the only one going through this because it's really sad.